Well, hello, and a very warm welcome to our participants, the Jocelyn's and Felicities and Cynthias of the world. Glad that you could join us today as we embark on an exciting journey, taking a look at future-proofing your practice, where we'll delve into the depths of payment strategy. I am your host, Peter Haas, and I'll be conducting this enriching session, and I'm truly thrilled to have each and every one of you with us. As a little bio about me, I personally joined the ranks of healthcare many years ago as an executive director in the long-term care and rehab space. When it comes to billing, whether it's on the patient or insurance side of things, you will never find a more empathetic ear. So before we get going, we understand that questions will arise during the webinar for many of you. However, to ensure all questions are answered promptly, we ask that you please either write them down or remember them for later. During the last 15 minutes or so, the webinar will have some time set aside for Q&A. So with that, let's get started. Over the next 30 or so minutes, we'll explore different ways patients like to pay, why some aren't paying or delaying payment, how to keep patients happy through the process, necessary tech for our practice's financial health, and valuable, actionable insights for up-leveling our billing and payment solutions. We'll be unraveling additional insights and sharing valuable perspectives. So whether you're a seasoned professional seeking to enhance your expertise or a curious mind eager to discover new horizons, you are in the right place. Get ready for what I like to believe is an engaging and thought-provoking experience as we embark on this learning journey together. The changing healthcare landscape. As a reminder of what B2B and B2C stand for, because we're going to be discussing these terms. B2B is business to business, or it's a transaction that takes place between one business and another, such as a wholesaler with a retailer. And business to consumer implies that we're going from a business directly to the customer with no middle person. Now, traditionally, physicians, hospitals, laboratories, they've designed their pricing and billing systems around wholesale or business-to-business relationships with insurers. Transactions move in batches long after the patients have left their doctor's office to be processed by insurance companies for initial payment before billing for the balance. As a reminder, traditional does not necessarily mean most effective. And because of such, the healthcare landscape is quickly transitioning from B2B to B2C. Patient obligation is now over 50% of the healthcare dollar. Like many other industries, healthcare is impacted by changes in consumer behavior. We're all sitting at our computers right now. With the world's information at our fingertips, we can use online search engines to look for millions of different topics, millions. And yet 1 in 20 Google searches is now for health-related information. 72% of internet users look online for health information, and 35% of adults go online to figure out their medical condition. And cost of care and travel time together comprise more than 70% of consumers' choice when selecting medical providers. With the shift in financial obligation weighted heavily on the patient, it's increasingly essential for practices to adopt efficient billing and payment processes. Research shows that as patient financial responsibility continues to rise, the likelihood of collecting patient payments in a timely manner significantly decreases. Makes sense. So how do we overcome patient payment objections in order to accelerate patient payments? Do any of these sound familiar? My preferred payment options aren't offered. Medical bills are not a priority. I'm confused about what I owe. I don't know where to pay. I can't afford to pay that much. I didn't know I received a bill. I'm assuming that we hear between 1 and 6 of these on the daily. I can only see a couple of your faces, but I did see some nods. So in order to overcome these common objections, we have to start by addressing the root of the issue. So we need to identify the source of the problem. What is the real issue? Why aren't they paying? Why don't they understand? Then we have to acquire the right tools necessary to address and fix the concern. And then you need to see results. My preferred payment options aren't offered. So what does this even mean when we hear that? We're going to touch on this again later, but to know that over 80% of patients would consider switching providers for a more convenient payment option. It's a pretty startling statistic. And it's actually 84% if you're talking about millennials. So what is the solution? Well, are we accepting all the different types of payment methods that our patients are interested in? And what you see here is just a list of different modalities that there are. Cash, checks, credit cards, whether it's online payment or in-office payment, not having to re-enter my credit card information because there's some sort of stored payment method, right? Maybe it's Google Pay, Apple Pay, Tap to Pay. What are we used to? What are we looking for? If we limit ourselves in the number of options available, then we're limiting the number of patients that we can potentially offer care for. Is it that big of a deal? It is. I can't afford to pay that much. That's an interesting one. We see a lot of patients. We know a lot of our patients, and we feel like they should be able to pay their responsibilities or obligations. So where does this idea of I can't afford to pay that much comes from? Well, interesting statistics that nearly 20% of all patients get sent to collections. That is almost 1 in 5, a startling statistic. On average, medical bills sent to collections range anywhere from $750 to $2,600. In this study that you see, the average was only $579. But yet it still made the list. Approximately 50% of consumers with medical collection debt show no other evidence of financial distress. They ordinarily pay their other financial obligations on time, and they have more available credit, which they could use to repay their debt. And they're more reliable payers than most other consumers. So why? Why do they end up in collection? Well, in a survey by Harmony Healthcare IT, they found that only 35% of respondents, 35% of us, set aside savings for medical emergencies. Which makes sense because another statistic said that 63% of people are unable to cover a $500 emergency expense. So that's right in line of what we know. And why aren't we able to pay it? Well, you have to think that a lot of times a medical expense comes out of the blue. It's nothing that we anticipated. So while we're paying our other responsibilities, we're paying our mortgage or our rent, our car payment, our cell phone bills. Those are things that we anticipate. They're things that are set up on auto pay. So what can we do to help? One thing we can do is provide good faith estimates of the financial responsibility prior to seeing the patient whenever possible, so they know what to expect. We need to identify concerns and establish automated payment plans before they're seen. 90% of patients will pay their bill in full if they have a way to pay it. The third on here is offer discounts if they pay in full. We're not talking about 50%, although that sounds nice as a consumer. Even a 3 to 5% discount can make a huge difference. It's no skin off our nose, but it makes a big difference in the perception of the patient, the payer. I'm confused about what I owe. I think we all know that one because we've taken the phone calls of people saying, I'm confused. Well, there is a knowledge gap in health coverage literacy. A landmark Department of Education study concluded that only 12% of adults had proficient healthcare coverage literacy. Only 12. 53% had intermediate, 22% had some basic knowledge, and 14% had below basic healthcare literacy, which means they don't know what's going on. They don't understand their own coverage. 3/4 of Americans aged 22 to 64 report that they know how to use health insurance, yet only about 1/5, that 20% you see on the right, could calculate the cost of a routine doctor visit. Only 16% of healthcare consumers were able to calculate what they would owe for out-of-network lab tests with a capped allowable charge. This doesn't just lead to potential patients or consumers having trouble understanding their bill. It also leads to people not going to visit their provider because of these concerns. Same study we're talking about found that 79% of healthcare consumers understood that a health insurance premium is paid monthly, yet only 28% of them could identify the correct definition of deductible. And that seems crazy to us because this is the world we live in. This is our talk 8 to 12 hours a day. But it's not the same for the patients that we're serving. So what can we do? One of the things we can do is communicate patient responsibility and determine payment schedule in advance. Same that we were just talking about. Ensure clear and consistent amounts in billing. Communicate amount due across all billing methods: mail, text, email, phone. Are we sure that on our statement that we are clear and concise, that we're not using legal or doctor jargon, that we're not saying heptic, but we're saying liver disease? Patients need to understand what they're paying. When they're confused, it leads to delayed payment, if not payment abandonment. Medical bills are not a priority. This is an interesting one. So what is a priority? 53.6% of American workers covered by private health insurance through their employer were enrolled in high deductible health plans in 2022. That's up substantially since the 39% or so in 2015. High deductible plans offer low or lower monthly premiums, which are attractive to many consumers. However, when it comes to prioritizing their bills, if you see on this chart, consumers prioritize paying their premiums, but not their medical bills. So again, what does that mean? The mortgage, rent, the utilities, these are things that are anticipated, expected. The health insurance premium comes automatically out of the paycheck every month. It's there. The medical bills, much further down the list, something that they generally not anticipate. So what's the solution? Well, what if we used automatic payments like their other bills? What if we allow payment plans when necessary? Collect before the appointment whenever possible. Transition billing communications to a B2C approach. So firm payment expectations at time of service, and then communicate consequences for non-payment, accrued interest, sent to collections, etc. But this idea of B2C, and we're going to focus on that as we go throughout the webinar here. Here's a funny one. I didn't know I received a bill. And I say funny because I've actually been that person where I opened a statement and set it aside and then never thought I received it. An online survey conducted by Consumer Action found that up to 3/4 of those surveyed opted for bills to arrive by mail, 74%. For each of 9 types of bills and invoices, consumers chose paper over digital delivery, with medical bills actually leading the preference with these respondents. 74%. We get asked all the time, well, should I continue to send a mailed bill? Can I not just send an e-bill version? And as we focus on that throughout this webinar, I think this is the first, hopefully eye-opening response to that, which is mailed statements are still important. 74% of us expect it, want it. Providers often assume that once a statement's been mailed, however, that the patient is aware that he or she has a balance. However, younger patient populations don't check their mailbox as frequently as you might think. In fact, I myself am certainly not what you'd consider young, and I'm probably a twice a weeker when it comes to collecting my mail. When bills do get discovered, they're often set aside to be dealt with at a later date. They go in the inbox pile. The problem is these bills often become an afterthought and they're not dealt with until much later, or sometimes not at all. According to Inc. magazine, millennials check their smartphones over 150 times a day on average. Cell phones are a great place to reach these patients if you really want your bill to be seen and dealt with quickly. If your practice has not adopted text messaging as a way to notify patients of their open medical bills, it can be a good solution to getting the attention of this patient population. In fact, industry data reflects sending electronic statements in addition to paper statements. In addition to, will typically cut the average days to payment from 20 to 9. And in a business where cash flow is king, pretty important to save those 11 days. And it will also boost the percentage of total collection from 77% to 95%. That's an 18% increase. I just left it here for a second in case you wanted to write those stats down. So what's the solution? By leveraging multiple billing methods, such as our traditional mail, coupled with email, SMS notifications, patient portals, providers can significantly increase the chances that patients are aware of their financial responsibilities, and that is step one. This strategy not only caters to the diverse preferences and accessibilities of patients, but also reinforces the message through various channels. I get my mail, I look at it, yes, I owe the doctor. I check it to make sure I understand why I owe them. Then I put it away. And then I get a reminder, a text message or an email. Oh yeah. And then within 8 minutes, I make my payment. And when I say I make it, that's the statistic, the industry average. I don't know where to pay. If we offer and communicate multiple payment options through all billing channels in the office, that's how we overcome that. If we make sure that our communication is clear, that on the statement, it gives us step-by-step instructions. By incorporating a variety of payment methods, you see a bunch here, the online portals, the mobile payments, in-office payment terminals, traditional mail. We as providers can accommodate the diverse preferences and needs of all of our patients. Studies have shown a direct correlation between payment options offered and the rate of timely payments, with practices offering more flexible payment methods seeing a 30% reduction in late payments. On a personal note, a week ago, I just received a bill from my youngest daughter's pediatrician. There is no way on that bill for me to pay. There are no instructions to pay. So it tells me what I owe, but there's no QR code. There's no URL to tell me to pay online. There's not a phone number that says call us and pay. So my assumption is that they want me to write a check and drive it to the office. I don't, unless they wanted me, I mean, I guess I could throw it in an envelope and look up their address that I threw away the envelope it came in, so I don't know what it is. It is not a convenient method that they've imposed on me. Had they had an additional way to pay, I would have opened it and paid it on the spot. Most likely, I would have opened up my phone and paid. But instead, we're a week or two in and I haven't paid, and I don't know when I'm going to get to their office. So equally important to flexible payments is the proactive communication of these options through every patient interaction point. Billing statements, reminder emails, SMM alerts, verbal reminders during office visits. A comprehensive approach ensures that patients are well informed about where and how they can fulfill their financial obligations, thus removing barriers to payments and enhancing the overall patient experience. And that's what I didn't have. I didn't have the where and or the how. Very frustrating. I'm sorry to unload on you guys today. The role of technology has become increasingly integral in shaping the patient experience, streamlining administrative processes, and optimizing the financial health of healthcare organizations. So let's look at some examples of how technology can have a positive impact on the payment journey in healthcare. Patient payment portals. As I mentioned earlier, while 74% of consumers still prefer to receive medical bills by mail, 85% prefer to pay their bill online, underscoring the need for us as providers to offer this option. Online payments are convenient, providing patients with flexibility to settle bills from anywhere at any time. They also offer transparency, allowing patients to review charges and payment details while maintaining security through encryption protocols. The quick processing of online payments benefits practices by ensuring timely receipt of funds. Overall, online payments enhance the patient experience and streamline revenue management, aligning with modern digital trends. This is what they're anticipating. This is what they're expecting. Practices are increasingly utilizing electronic bill notices in addition to mailed statements to inform patients of their outstanding balances, payment due dates, and available payment options, enhancing communication and encouraging timely payments. 85% of consumers check their messages within 1 to 5 minutes of receiving them. So the sooner your patient receives their bill, the sooner you can get paid. Payment gateways, they've become an integral part of the healthcare payment process, offering numerous advantages for both healthcare providers and patients. In fact, if you look on the screen, digital payments in healthcare are expected to reach almost 60 billion by 2032, meaning it's quickly becoming the standard in healthcare. And when you look at that chart, you'll notice it doesn't go back to 1918, that's 2018. So let's go over a few of the benefits of payment gateways. Secure transactions. So payment gateways ensure the security of financial transactions, but how? Well, they utilize encryption and adhere to industry standards to protect sensitive payment information, maintaining patient trust and safeguarding against data breaches. There's fast payment processing. Electronic payment systems enable swift processing of payments. Patients can make payments online or through mobile apps, which are processed in real time, reducing the time it takes for healthcare providers to receive the funds. Fast processing also leads to a better patient experience because there's nothing worse than waiting for a payment to be debited from your account, wondering when it's going to happen. Also keep in mind that the last interaction we have with a practice is not the visit with the provider. It's generally the payment. So I don't want to beat a dead horse, but my frustration with my pediatrician did not stem from his ineptitude as a doctor. He's actually quite good. It's come from my post-visit experience. I'm now the statistic, right? 84% of millennials will switch providers if they don't offer the payment options they're looking for. This is real. But anyway, I digress. To keep on track, payment gateways also offer a reduction of administrative workload. By automating payment processing through a payment gateway, you reduce the administrative workload associated with any manual payment handling. This type of efficiency allows healthcare staff to focus on other critical tasks, therefore enhancing overall operational efficiency. This is what we want with our staff. By utilizing payment gateways, you're offering a secure, efficient, and convenient solution to collecting patient payments. Embracing the revolution. So Bill Flash solutions stand at the forefront of addressing the critical needs of healthcare providers by offering automated billing and payment solutions designed to drive faster patient payments. So let's dive into some of the services that we offer. How does Bill Flash address the critical needs of healthcare providers? By providing a one-stop shop for increasing the efficiency of patient billing and payment experiences. With Bill Flash, you can consolidate your workflow into a single, easy-to-use platform to manage billing, payment, and collection processes with ease. All services work seamlessly together to streamline vendors into a single application with unified reporting and a single support phone number to our entirely US-based customer support team. So let's take a look at these services. Print and mail billing. Print and mail statements continue to be the most reliable way to legally advise someone of their financial responsibility. This is largely because of USPS delivery success rates. We know it's going to show up where it needs to go. Customizable templates allow you to easily add, edit messages, specify the forms of payment you accept, or even change the color of the statement. You can set up different templates by location or practice. You can easily review and edit and approve the files, the statement files. Only approved bills are printed and mailed. During your review, you can delete or perform the aforementioned add, edit messages, change color, etc. Fast delivery. How fast? Approved bills are mailed first class USPS the next business day. Automatic address updating. Oh, finally, no more return bills that you have to pay to resend. With the USPS National Change of Address Service, the NCOA, bills are automatically mailed to the new address, and then you get a report of changed addresses so you can update your system. Isn't that nice? Coupons and envelopes. Helpful payment coupons and return envelopes are included, which when used reduce your processing costs and any other troubles that come of that. You can view mailed bills. Staff can view the same bill that the patients receive so that they can easily understand and answer questions. And then you get your billing reports so that you can easily find bill processing details and change of address reports to update your records. And last but not least, billing statements made even better with QR codes. This is something that we added this last year. Now you can give patients what they want, the reliability of mailed statements coupled with the convenience of online payments. That's what QR codes do. They unlock that capability and make your mailed statements have even more value, driving faster payments. Patients can easily access their bills by scanning the QR code printed on the statement. What that does for the individual paying is eliminate the need to search for the payment portal or enter lengthy URLs, saving time and reducing potential errors. If you're a biller saying, but will people know how to use QR codes because I don't, rest assured that yes, the large majority of our demographic do know and continue to use QR codes and asked for it and pleaded for us to have them. By incorporating QR codes, we've empowered your patients to take immediate action. Convenience fosters a positive patient experience, not only increasing the likelihood of prompt payments, but the likelihood that you retain them as a patient and give them more opportunities for convenient payment in the future. Our QR codes are designed to securely redirect patients to our encrypted payment portal, ensuring that sensitive information remains protected throughout the transaction process. E-bill notices. Communicate with your patients where they're at, on their phones. The sooner your patients receive their bills, the sooner you get paid. A free online e-bill or electronic bill is created with each approved bill and available to view and pay the same day at our online pay patient portal, myproviderlink.com. E-bill notices allow you to send same-day notification via text and email. So a reminder, the mailed statement goes out next day, USPS first class mail. E-bill notices can go out same day, text and email. Customizable templates allow you to control the messaging. Electronic billing eases the payment experience for both patients and practices by giving the patients their preferred e-bill notices and email and text wherever they can view them, wherever they want to pay them in just a few clicks. E-bill generated online payments eliminate the cost and hassle for staff to handle additional payments in the office. Bundled savings. When we're talking about sending e-bill notices, so text or email through Bill Flash, you can send one or the other or both together for the same price. You even get additional discounts when sending e-bill notices along with mailed bills, which of course we always recommend. I'll touch on the total collection from 77% to 95% again. We also touched on the fact that by pairing the convenience of e-bill notices along with the reliability of mailed bills, you can accelerate payments, reducing the average days to payment from, if you didn't write it down, 20 to 9. So you get paid more and you get paid faster. That is a better duo than Batman and Robin or peanut butter and jelly. Streamlining revenue collection is essential, not only for the financial health of the practice, but also for enhancing the patient experience and maintaining overall stability in the healthcare system. By integrating Bill Flash Pay, you can deliver faster payments at a total lower cost, while also providing a way for practices to consolidate their vendor management by offering both a secure online payment option as well as modern EMV terminals for processing payments in office and over the phone. So not just card readers, but EMV terminals. Bill Flash Online Pay gives your payers the flexibility to pay anytime, anywhere through our secure payment portal at myproviderlink.com. This option frees staff from payment handling, hassles, and expenses. Bill Flash Office Pay allows you to accept multiple cards with a swipe, insert, or tap using our smart EMV cloud-based solution, which also facilitates Apple Pay and Google Pay. Going back to, are we offering all of the options? By taking advantage of both Office Pay and Online Pay, yes, we are providing our patients with all the different payment options they're looking for, which means they're not looking elsewhere. Expanded gateway options. Now, for practices that already have a merchant account with a specific payment processor or provider, it's essential that any new payment gateway seamlessly integrates with their existing setup. Bill Flash's gateway is designed to do just that, making the transition to our services hassle-free. This integration allows you to continue using your preferred merchant account while still benefiting from Bill Flash's additional services and features. If you don't have an existing merchant account or you're looking to explore better rates, Bill Flash offers exclusive discounts with merchant accounts. Stop wasting time chasing patient payments. Let BillFlash do the heavy lifting. With the new integrated collection service from NextTrust, you can experience first in the industry convenient submissions from customer-controlled rules that generate recommendations for collection services. You can then review and approve which accounts are sent. A unified workflow for sending recommended collections while routinely sending statements. A solution that is as soft or aggressive as you want to be with customizable settings. Our solution allows practices to focus on collecting for more recent visits, while the BillFlash integrated collection service collects on older patient balances. And here are a couple of the big ahas. All recovered payments are received directly into your merchant account through BillFlash Pay Services. And then we invoice for our fees. And so your practice never has to wonder again if you're being paid correctly. So I want to touch on that one more time. All recovered payments are received directly into your merchant account. So this isn't we send the statements off to a collections company, and then they send us a check, and we hope that there's full transparency. Everything comes directly into your account. Our recovery specialists are certified in all 50 states, and we do the difficult work so you can focus on patient care. That's why we're in it in the first place, right? By seamlessly integrating with more than 100 existing healthcare practice management systems, BillFlash streamlines the entire billing process, from generating and sending out electronic statements to facilitating secure online payments. This automation not only significantly reduces the time and resources required to manage patient billing, but also minimizes errors and delays often associated with a manual process. The result is a more efficient billing operation that accelerates cash flow, improves the financial health of your practice, and allows you to focus more on delivering quality care rather than managing financial transactions. As we approach the conclusion of today's webinar, I want to express my gratitude to each and every one of you for joining us. It has been an enriching experience, sharing insights, knowledge, and ideas, and I hope that you found value in the presentation. Remember, the journey towards success is ongoing. As you implement the strategies and information shared today, keep in mind that growth and progress take time. Stay persistent, stay focused, and continue to embrace a mindset of continuous improvement. Collaboration can be a powerful tool on your path to success. We are here to assist you in your endeavors.